So here you are watching coblation adenoidectomy in a 3.5-year-old child with a history of mouth breathing. What a saline, please. I'm just waiting for this coblation saline to see. Without saline, it does not work. So this is a 3.5-year-old child with history of snoring and mouth breathing, and you can see the adenoids are almost grade 4, grade 3, grade 4. I'm starting at the upper end of the adenoid. The wand has been bent by 40 degrees. 0-degree endoscope is going through the nose, and I'm starting from the superior boundary, which is the periosteum below the sphenoid bone. You can see the boundary very clearly. Once the superior boundary is identified, then we'll debulk the adenoid. And as expected in a small child like 3.5, the adenoids are soft. So they are getting debulked, ablated, or melted, whatever you want to call it, very fast. So I'm just debulking the whole adenoid with coblation plasma, going layer by layer, completely removing the tissues. And we'll gradually go for the posterior boundary. This is the lateral boundary. I'll come to it later. Let me first debulk and reach the posterior boundary. If your scope is fogged, not clean, you can just gently clean up the scope like this by touching it on the tissue, and sometimes if required you can also pour saline. Now, since there is no important tissue in this, I'm being a little fast. You can see that's the superior boundary completely cleared. And there will now reach the posterior boundary in a moment. Before that, let me debulk as much of tissues as possible. So here, as we reach the buccopharyngeal fascia, you can see the buccopharyngeal fascia very clearly. That's the posterior boundary. You can see the fascia very clearly. And this was the boundary defined by us in 2016. first time in medical literature. And that's the inferior boundary, which is the Ascendant's ridge. And as you see, when I reach the inferior boundary, you can see the contraction of the muscles. That tells us that the inferior boundary has reached because of the contraction of the muscles. So posterior boundary, inferior boundary, superior boundary, and after doing this, I'll come to the lateral one. Let me first show you the posterior boundary all around. Without opening up the fascia, we must be able to remove all adenoid tissue completely without opening up the fascia. Because if you open up the fascia unnecessarily, the child will have pain while lifting the head. There's no great consequence. There's no big complication even if you open up the muscle, but unnecessarily the child will have pain, which we do not want to have. So you see, everything is removed. Now we are coming to the lateral boundary. So this is the fossa of Rosenmuller at the back. This is the fossa of Rosenmuller. This is the lateral boundary posteriorly, and this is the torus tuberous, which is the lateral boundary anteriorly. In this case, there are no lymphoid tissue on the torus tuberous, so I do not need to do anything on that. On top of that, otherwise, whatever tissues are there laterally will take off the tissues completely, and many times these small bits are left. So that's they can regrow and create symptoms, and they can keep on causing postnasal drip. So we must take care of all these adenoid tissues completely. Now, whatever little is there on the torus tuberous, I'm even taking care of that so that later on this tissue should not hypertrophy. At the same time, I must make sure that I'm not getting into the muscle. If I get into the muscle, then there will be a problem. This is the eustachian tube here, you can see it. The torus tuberous is absolutely clear, whatever little adenoid tissue is there. On the lateral side, if I do not want to ablate, I can actually just coagulate and this tissue will become fibrotic. Extremely laterally, there are some blood vessels. I do not want to unnecessarily get into any small twig which might bleed later on. So I'm just coagulating this area. Now you see the boundaries of the adenoid on the left hand side. Superior boundary, the periosteum; posterior boundary, the buccopharyngeal fascia. You can see it all around. Lateral boundary is the fossa of Rosenmuller posteriorly and torus tuberous anteriorly, and inferiorly is the Passavant's ridge. Now I'll go on to the right side. Whatever I can do from this side, I am doing. And you saw that the scope has not even come out once. The wand need not have to be cleaned many a times. So if you have the correct technique, you will be able to do a good job without having the need to declog the wand or even removing the scope and putting it again and again. Now that's the posterior limit completely. This tissue is already fibrosed, so we can leave it. This is the live tissue which we are removing. Now I'll go in from the right side because obviously we have reached completely on the right. So now I'll try to go in from the right side of the nose without traumatizing the turbinate or the septal mucosa. So space is just a little less. It's not a problem. Can you pour some saline, sister? Oh, it's okay. It's okay. We are good. Now you see that's the adenoid on the right side. So again, I'll start from the superior part. We'll remove completely. Go to the superior boundary. Remove all the tissues. That's the torus tuberous. Completely cleared superior boundary. Now going laterally towards the fossa of Rosenmuller. Again, cleaning of the scope. It's okay. Posterior boundary, superior boundary completely removed, achieved clearance. Laterally complete. That's the fossa of Rosenmuller, completely cleared. Now we'll go for the complete clearance of the posterior boundary. Little bit on the lateral side is left. I'm cleaning up that. And that's going towards the posterior boundary completely till the as buccopharyngeal fascia everywhere, not leaving behind any tissue. This is the inferior boundary, the passivant stage. You can see the contraction of muscles. And little bit tissue on the posterior boundary being removed. Nothing left to chance. That's a small vessel. I'm coagulating once more. A little bit of tissue here which I'm coagulating. The central pit. And so the fascia should not be opened up anywhere. All the tissue is removed. Little bit of tissue on the torus tuberous, very small amount. Superficial ablation, not going till the muscles. Removed all the lymphoid tissue. Muscles should not be involved. And that's almost a complete adenoidectomy, not leaving behind anything for chance. Just coagulating this lateral part, not going very deep. Very in the depth. There can be small vessels, so not going very deep. That's the end of the surgery. You can see all the boundaries on both the sides. Thank you for watching.